Hello everyone. My name is Lan Jiang. I'm a PhD candidate in University of Illinois Urbana-Champaign. I'll present our work. Our work is leveraging large language model for assessing the adherence of randomized control trial publications to reporting guideline. The background of this work is that those reporting guidelines, Spirit Consort, are developed to improve reporting quality in randomized control trial. However, low adherence to guidelines still demonstrate that only journal endorsement is not sufficient to ensure authors report the minimum recommended information. And recent advancement in natural language processing, especially in large language model, offers potential for automating this process. So in one of our prior work, we annotated a data set of 100 pairs of protocol and result publication pairs. And in that data set, we match in sentence and articles to Spirit CONSORT checklist item. And we also developed an NLP model for recognizing reporting of checklist item. And this model achieving an F1 score around 0.9 for both Spirit and CONSORT. And F1 is a harmonic mean of positive predictive value and sensitivity. It's a combination of those two scores, and it's range from 0 to 1. And you can see here is an example. The model can matching RCT protocol to Spirit checklist item, and it can detect whether each item has been reported or not. That's our prior work. And in the current work, we try to assess manuscript in more detail. We want to assess whether randomized control trial manuscript include recommended detail information, and we plan to use generative model to do that assessment. And to do so, we developed 119 questions to assess the presence of Spirit 2013 and CONSORT 2010 elements. And we ask annotators to answer those 119 questions. And we use human annotated text to answer this question. That means that you can see the right bottom corner. For example, when we answer a question related to intervention, we will collect all sentences describing the intervention and provide to annotator and ask annotator to answer questions based on those relevant tags. And to do the experiment, we prompt GPT-4o to generate, to answer same questions for each article. Since we need to provide relevant tags, those relevant tags can either be identified by human, that is human annotated tags, or it also can be tags extracted by our prior work. So we do those two experiments. And for those 119 questions, 85 of them are check 1 questions and 34 of them are check apply. And here are examples for each question type. Regarding the annotation process, 2 experts in trial design independently rated and adjudicated the protocols and results articles for 25 trials. And we calculate inter-annotator agreement, which is cohesion kappa. It is 0.94, which indicate a very high inter-annotator agreement. Then for the rest of the articles, the 75 pairs of the articles, they were rated by 1 expert. And we also examining the data set. We find that many articles does not report specific items. That means when answering some question related to those items, there will be no relevant tags. To be more specific, for around 24% of the questions, more than 80% of the article did not report the relevant item. And we also find that the responses are highly skewed. That means that for around 52% of the questions, the same response will be selected for more than 80% of the articles. Here is how we prompt the GPT-4o. Yeah, we did chain of thought reasoning. So we first provide GPT-4o with general instruction, and then we provide relevant tags, and then the question to be answered, and as well as the options for that questions. And then we specify the response format. And in the right part, you can see the GPT-4o can answer this question correctly, and it also can identify the tags described 3 times daily, which indicates the frequency of the dosing schedule. And to do the experiment, we follow prior work. We use 70, 10, 20 train valid test split. And all those experiments are evaluated on the test set only. So we have done 3 experiments for now. The first one is by chance. It's just for comparison. This one is we try to select the most frequent response from for each question from the training set. The other 2 are all using GPT-4o to answer those questions. The first one, human annotated tags as input, is we provide relevant tags that are identified by human annotators. And the model extract text as input indicates that the relevant text is identified the model we built in the prior work. And by seeing the results, we can see the model achieve similar performance for both Spirit and CONSORT. And those results are calculated by F1, which is a combination of a positive predictive value and sensitivity, and it ranges from 0 to 1. And you can see that at the right column, it's the model extracted text as input. The performance pretty well. And you also see that the by chance would achieve a pretty high performance. That is because the characteristic I just mentioned, it's that the highly skewed in the response. So only select the most common response would be still achieving a high performance. To be more specific, the model extracted text as input achieving F1 as 0.832, and the positive predictive value and sensitivity are also around 0.83. And by grouping those results according to the question type, we are able to see that the model works better on check 1 questions, but slightly lower on check all applies. And we did plot the performance of the for those questions, and we see that for most of the questions, the model achieved more than 0.7 F1 score. And here is an example of the model the model works well. The upper one is about the dosing schedule. The model can work pretty well. It's achieving F1 score at 0.9. But the bottom one is about the consent process. The detail of those consent process, the model cannot work well. So to be conclude, our 119 questions help pinpoint missing RCT characteristic in greater detail. And we believe that LLMs hold promise for evaluating RCT adherence to reporting standard. And the future direction is to explore how to efficiently use those response, to integrate this response to peer review workflows. And a question we also ask ourselves is, do editors and peer reviewers want automate assessment of those hundreds of items? Yeah, that's it. Yeah, any questions?
Great, thanks so much for an interesting talk. I think we'll start in the back.
Thank you. Kyungwon Hong from NIH. Congrats and great work to you and your team. Two questions. Based on your abstract, you said the check one, like the question was, does the manuscript report any result for non-systematically assessed harm? Was there any reason for choosing that particular question as a check one? Second question, unlike research article, which typically follows IMRED format, protocol, I think there is not necessarily like a structured format per se, although there is like a spirit guideline. Did you face any difficulties or challenges, especially testing spirit, like adherence?
Yeah, for your first questions, yeah, we did have a lot of check one questions, and those questions we just want to ensure whether the manuscript reports something or not. So those are yes no questions. So it's a check one, and we also have some like for each item we probably have more than one question to be answered. So some of them might be check one, check all apply. So for those more questions that like check the manuscript in more detail, these are check all apply. So I believe for each item we have a few questions that covers all perspective, like those minimum information recommended by those reporting guideline. And could you please repeat your second question?
Sure.
Thank you.
My second question was, unlike research article that typically follows IMRED, like intro method, result, discussion format, protocol, although there is like a spirit guideline, I don't think there is like a structured format per se. I just wanted to hear your experience. Were there typically like particularly more challenging? Like how's your experience with, testing the spirit adherence?
So I think it's more related to extracting the relevant tags, maybe, because in our prior work we did build a model to recognizing reporting for each item. So the order of those of those reporting does not affect the our model, because the model would try to predict which item is trying to describe for each sentence. So then it will try to give each sentence a prediction, and then according to those prediction, we will collect relevant tags. So we don't rely on the order of the manuscript. Yeah, thanks.
In the front.
Vivian Bachelet from Chile, University of Santiago. Congratulations on your work. I've been waiting for this kind of research to come up and be reported in this meeting. I actually came to this meeting the last time wanting to hear more about this kind of applications, and now we've got, there's just so much going on. A comment, I remember hearing Anna Marusic in 2012 in the symposium on reporting guidelines. Anna, I don't know where do you remember? How far have we come in this area of reporting guidelines? And I understand it's really difficult to try to get this high predictive value applying CONSORT 10 to 2010. Now there is a CONSORT 2020, yeah. So you're going to have to adjust everything for that. But do you are you thinking of exploring something along the lines of strobe? And I'm saying this because in my region in Latin America, most of our research is observational research, and it is so hard to get good reporting standards there. And to your question, whether we are interested in incorporating this in our editorial workflow, what can I say? Yes, of course.
Yeah, thank you for your comments. And is there a specific question? Sorry.
Are you thinking about
Sorry.
making a strobe like guideline for this kind of work?
Yes,
Maybe you can repeat the question.
Are you considering expanding this work to other reporting guidelines, such as strobe for observational studies?
Yeah, of course. I think in the current stage, we want to like in the you can see we only explore a few experiments for this spirit and consort, and probably after this study, we probably want to explore it to other guidelines. I think after we have a like more acceptable performance, we can move to another guideline, and it requires us to first do the annotation, so it will be a long process.
In the back, please.
Alex Goldberg from Computer Science Department at CMU. Thanks for a very interesting study. I was wondering on your future work, potentially showing this to peer reviewers, you noted there's very many questions. Do you have any sense of whether manuscripts tend to have a large number of errors all at once or just a couple? Because I would think like the cases that you might want to flag to peer reviewers the most might be these cases where there's like systematic gaps in reporting on many, many questions.
Sorry, could you repeat that?
Yeah, do you have any sense for whether there's manuscripts where, like whether when people did not report certain things on the checklist, it was for a given manuscript, like a large number of missing things, or just a couple on each one?
Yeah, I think there are a few rarely reported items. For example, the changes to outcome. And I think there for all those 200, like 100 pairs of article, only maybe 3-4 reported it. So yeah, I do believe that there is item that this manuscript really reported, and that means like also I show that for some articles, like lack of specific item reporting for in many articles, but that does not affect building the model. And we hope by utilizing the model we built, maybe in the future, the author may like, we can give this indication to the author, the author would be aware of they maybe forgot to mention some of the specific item, and they would like do that before the submission.
In the front.
Steve Finn, JAMA. I also think this is a great paper, and as another editor, I would think this would be a very useful
Yes, thank you.
tool. My question is for the items that you observed where the model tended to perform more poorly, was that a function of the model's performance or an ambiguity in the protocol? And that's particularly, I think, going to be a problem with Strobe, which has some very general kinds of checklists, like was there evidence of control for confounding? So the question is whether the protocols, the checklists, ought to be re-examined for their specificity for this kind of application.
Yeah, I think some questions the model cannot work well, maybe partially because the model still cannot correctly understand some of the domain specific terms. So in the future, we also plan to explore maybe first define those options more clearly, and then maybe provide some example as a demonstration, so that like those generative model can learn more about those like domain specific terms. Then we hope it would like achieve a better performance, especially for those questions the current model cannot work well.